So, hello, everybody. Thanks for joining us. We're going to get started right away because we respect your time. My name is Dr. Lisa Dennis. I am co-president-elect of the Health Association of African Canadians here in Nova Scotia. And joining me is
Sharon Eady in Montreal, Health Association of African Canadians, Quebec.
yes, right on, exactly. So
Mhm.
tonight, just a little bit about for those who are new to Hawk and aren't really familiar with Hawk. Basically, we are a organization here located. The head office is in Nova Scotia, and we'll talk more about the one happening in Quebec real soon. But our goal here is to really fight for Black health. So our vision is thriving, healthy African Canadians, and our mission is to promote and improve the health of those African Canadians through various activities such as community engagement. We do education such as this under the Black Lives Living Well Learning Series. We fight for health policy recommendations, and we have lots of partnerships, and we also are involved in research. We are always looking for members to join and be a part, like-minded people to join us as we fight to improve the lives of Black people. So we have a great event for you tonight. Special treat, Dr. Yinka will be speaking. We're going to be talking about Black skin wellness within the Black community. She's our skin expert here in Nova Scotia. She'll be giving a really engaging talk. We've heard her talk before and we loved her, so we asked for an encore presentation. And so we have people joining us today from Quebec and Nova Scotia. And anybody else that you may have invited. I'm going to ask you, we're going to hold questions until the end, but please put your questions in the chat and I'll keep prompting you as we continue. And then we'll ask Dr. Yinka those questions for the Q&A. And I'll let Sharon do the honors of introducing Dr. Yinka.
Good evening, everybody. Dr. Yinka Ikendeko is a family physician practicing in Dartmouth, Nova Scotia. She finished her medical school in 2004 and has worked as a family physician since 2012. She completed her postgraduate training in London, England. Excuse me. Dr. Ikendeko moved to work in Dartmouth, Nova Scotia in 2019. Her clinic incorporates all aspects of family medicine, including prenatal care, child health, preventative area, and end of life support. Excuse me. Her special interests are dermatology and health equity. She is a member of various medical organizations, including being a board member of the Health Association of African Canadians. Dr. Ikendeko enjoys traveling and reading. And so without any further ado, Dr. Yinka, you have the screen.
Hi, everyone. Thank you for having me. And I was a little bit excited because I thought there would be like a French and I could pretend to know a bit of French, like, oh, merci, no, no, oui, oui. Like that's the full extent of my French, but I could, like nod along like I knew what was happening, but I really don't. But I still plan to learn French. So I'm going to share my slides if that's okay. Um, so there we go. So I'm a family physician. I'm not a dermatologist. I'm a family physician in Nova Scotia, in Dartmouth. And for a while, I'd realized that there was a huge gap in Black skin health, even beyond Black skin diseases in itself. Just healthy looking after our skin on a day-to-day basis. And that slowly became my passion because people kept asking, and I realized there was a huge gap that was not being met in, we didn't know what to do. And I'll talk about some of these today, including kind of new emerging themes that are coming up with Black skin health. And of course, our skin is the largest organ in our body, and it's the one we cannot hide. You can hide what your liver looks like, you can hide what your heart or your kidney looks like, but if your skin's unhealthy, you're presenting that way. People can see it. So looking after it is so important. And not only are diseases of the skin itself big issues, but also diseases of things that are not the skin show up on the skin. For example, jaundice. Jaundice would be, we would say yellowness of the skin for a Caucasian skin, but for a black skin, it's more like a darkening, like it looks darker. It doesn't look like the typical yellowness, but once again, the textbook would describe it as that. So those are kind of the things that we're touching on today. So, so we're going to be talking about the prevalent misconceptions about black skin. We're going to talk about sunscreen and systemic barriers. And sunscreen is almost like a good entry point, because you're thinking, if we can't get sunscreen, how would we get even other kind of higher level healthcare? And we'll talk about some common myths, and we'll talk about some insights into other conditions that affect black skin. But I will emphasize skin cancer because that's the deadliest of them all.
Dr.
So,
Inka, can you just put it into slideshow so we can make it bigger,
no,
please? Thank you.
sorry, can you see
Press-
now?
Yeah, press slideshow and we can see it bigger.
It says slideshow at my end.
Yeah, I just click on the where it says slideshow because it's not opened.
Mine says slideshow. Mine says
Yeah.
slideshow.
Press it
You
again.
need to stop sharing first and reshare again.
Okay, maybe it's okay. So 1 second. It says slideshow at my end. So so you're seeing the page with the African populations. Is that the one you're seeing? What are you seeing?
Correct. We're seeing African
Okay,
population. Thank you.
Okay, so this is kind of a reminder that the African subcontinent, or the African continent actually, and the descendants of the African continent have the highest levels of phenotypic, so how we look, and genetic, our genes, variation amongst all humans. So to stereotype people of African descent has no basis in science, because there are studies that say there are Africans that have more genetic closeness to the Japanese, for example, than to their neighbor in Africa, of Nigerian ancestry. And there are communities that live next door to each other that do not speak the same language. They would not be able to understand each other. So there's so much variation. And remember the Dinkas and the Pygmies. The Dinkas are the tallest people on the planet. The Pygmies are the shortest people on the planet. And both of them are in Africa. Remember Usain Bolt, who's the fastest human on the planet, is of African descent. And the Kenyans who run marathons the best are of African descent. And Fitzpatrick is how we color type our skin, the range of very pale skin to very dark skin. And a reminder that you can get all of this variation in Africa. And this picture would not be a surprise to you, because I grew up with people with albinism. So they had no melanin or very little melanin and were at very high risk of skin cancers, even more so than the Irish or the Scottish, because the people with albinism, people living with albinism will be in Nigeria, in a really hot, sunny country. So the risk would be higher. And then you have the dark skin. And even this doesn't have all the ranges that you would have on the continent. Okay. So the first myth we're going to talk about is sunscreen, because this seems like the commonest thing that comes up, where black skin or black people would say they do not need sunscreen. Remember that melanin gives a protection of about SPF 4 to 13. So once again, the range in skin color. So if you were the darkest person, you would be getting a sun protection of 13. And then if you were even lighter than that, you wouldn't even get that much protection. And the dermatology colleges in the world advise us to have at least an SPF, a sun protection factor of 30, of 30. So your melanin is not going to offer that much protection. People are like, oh, the sun's stronger than you. It's been here before you. It will be here after you. Your skin cannot be the sun. And the way to know is by the question of if Black people have sunburn. And some will say, no, they've never had sunburn. But you go sit in the sun in the Caribbean without shade, without sunscreen, and at the end of your trip, you will have these dry, flaky patches. You will have this dry patches, which is post-inflammatory hyperpigmentation from the sunburn, from the damage to your skin that the sun has caused. So we definitely do burn, and immediately you pay attention to it, you will realize it. And the biggest myth is the biggest question is always, what sunscreen shall I use? Which one? Should we, there's always the battle between these days. Should we use a mineral sunscreen? Should we use a chemical sunscreen? Are they dangerous for us? I can't find one that works for me because it leaves my skin looking like Avatar, like I'm on the film set of Avatar. I look bluish, I look whitish. And I always tell the story about one of how my passion grew a lot when I was invited to a teaching session where a dermatologist in the US had started a skincare brand and wanted to talk about his skincare brand, which was high-end luxury, really good stuff. He had an amazing reputation. This dermatologist, he'd been in the business and in science for maybe 30 years at that time. So they had invited a few of us to come to tell us about the product, to use the product on our skin, show us how chemical peels and things like that work with his range of products. And in that room, as is quite common in that case, I was the only Black person there. And so they would do a show and tell, show the product on the person. The next person will go, they would do that. And when it got to my turn, they applied whatever they needed to apply, and just to show you how it feels, how gentle it was. But when they finished, they'll put a sunscreen on because you needed the protection after this product. If I remember, I think it was like a kind of like a light peel they were showing us. So the one of the doctors there after mine said, "Oh, you've got something on your face. You need to wipe it off." So I took a bit of a paper towel or something and wiped it off. And then a couple of minutes later, he was feeling uncomfortable and he said, "You need to wipe a bit more off." So I picked that up again, give it a good rub. And another few minutes, he said, "I think you need to go in the washroom and see what you look like and do what you need to do." So I'm like, okay, excuse me. And then I went in the washroom and, I remember walking into the washroom and I walked into the mirror right in front of me there, just opened the door and there was the mirror. And it was like, oh my goodness, I just looked horrendous. It was white pastiness. And I got quite emotional for many reasons. One, I thought to myself, why did this person start a brand that was not befitting of my people and my skin color? And two, on starting it and now you're putting it on my face. If this person next to me hadn't said, "You look like a ghost. Hi, Casper, go sort yourself out," I would have walked out on the streets of Harley Street in England with the hoi polloi of England looking like I wanted to hunt people. And at that moment, this is not right. This just doesn't make sense, so disrespectful, so unkind. And it stayed with me. It's always stayed with me. So there's a lot of kind of thinking that goes into what sunscreen. Okay, now I believe you, Dr. Yinka, I need sunscreen. Which one do I need to use? So this is the picture on the left is an AI generated picture of what a sunburn would look like on black skin. But the one on the right is a real picture of what sunburn looks like. And I'm sure if you think about it, you definitely have seen that before. Very common when people go on holidays and come back, or they're out in the sun in the peak of summer and don't use any protection. That's what we get. Okay, and then the second thing is about skin cancer, or skin cancer doesn't happen to Black people. Well, we know it does because we've got the statistics. Now, sadly, Canada is still collating, or is being encouraged to collate data for Black for ethnicity data. So we don't have the Canadian numbers. So we have the numbers from the US and from England, which says that by far the commonest skin cancer that Black people would have is a type of skin cancer called squamous cell carcinoma, which is not, that dangerous. It can spread, but it tends to spread locally. Sometimes you get spread to other organs, but not the worst of them all. Basal cell carcinoma in about 20% doesn't spread that much. It tends to be kind of a local disease. Melanoma is the scary one, is the one that, for many decades was a deadly disease. If people were given that diagnosis, that was death. In the past decade, over the past 10 years, there's been such an improvement in the treatment of melanoma, and more people are surviving, but it's not translating to Black people. There's a condition called dermatofibrosarcoma, which is extremely rare. I don't think I've ever seen anyone with it. Even many dermatologists wouldn't have seen that before. And we do remember Bob Marley, and as many of us may or may not know, Bob Marley died of a kind of skin cancer that started in his nails, in his nail bed. And this is, we'll talk a bit more about this in a minute, because this is one of the issues with skin cancer in Black people. Now, I said to you about how melanoma treatment has improved over the past 10 years or so, but for white people, 94% survival rates, they will get better. For Black people, although I've quoted 70%, some studies quote 60%, some studies quote 50%. So almost half survival rates in Black versus white. And part of the reason is this. Black people do not know that we should be checking our nails, we should be checking our palms, we should be checking the soles of our feet, because we're more likely to have cancers in those parts of the body. And when we have Black spots, we're less likely to go to see the doctor. So one is because we don't know that it could be dangerous. And the second thing is, which I see quite a lot, and it shouldn't happen as often as it happens to me. Lots of people come to me and say, my dermatologist has said this, is this right? Should I do this? And that's a trust issue. And we understand why, because many Black people have been ignored and not looked after properly over the years. So there's a knowledge of this is what we need to be looking out for. Also, there's a trust issue. If I do go, will they look after me properly? Will they tell me the right thing? Will they use me as a guinea pig? Like, the Tuskegee experiment. We won't talk too much about it. But there is a history, which is why, the numbers don't look good for us. Also, skin cancer, like I said, is commoner in the palms of the hands, in the nail beds, same with the foot, but also in the eyes and in the mouth is more likely to occur in those places. Still yet, they're still rare, but those are places to look out for in Black people. And like I said, skincare products are not really targeted at Black skin. I've told you about sunscreen, but also even products like hydroquinone, which we'll talk a little bit about more, which is used for treatment of dark patches. In the Black skin, as many of you might have seen, if you use it for a long time, you get a condition called ochronosis, which is this dark blue or black patches you see on people that bleach their skin, lighten their skin. And ochronosis is not treatable. It's irreversible. Once it's happened, it's happened. But I cannot tell you the number of conferences I've been at where dermatologists say you can use it for a long time, because that's the case with Caucasian skin, but that's not the case with Black skin. You cannot use it for a long time. You can only use it for short periods. So even the products that are available, you can't use it the same way, right? So so when I did give this talk before, I gave it in a charity called Save Your Skin Foundation, and one of the people that was listening in that talk contacted me later, and we had a really interesting conversation. She said I had mentioned during my talk that public health campaigns did not have Black people represented in the pictures, in the images, because if I don't see me, it's none of my business. If it doesn't look like me, it's none of my business, right? It's the white people thing. It's nothing to do with me. So she was like, oh, of course that's not true. I'm sure in Nova Scotia we have representation of everything. And she said she looked through all their materials and nothing, not even one random Black person with a little finger poking out from the corner. No, there was nothing, right? So she was like, oh my goodness, you kind of become blind because you don't notice. But the Black person is not blind. They can see these white people on the billboard, so none of my business. So Nova Scotia, we work together to change the public health images, and that's been updated. And she also reached out to the Canadian Dermatology Association kind of to make sure that all of that's up to date, so that when we look at these sites, when we get the leaflets, when we see the campaigns, we are represented. So we know it's your business because you can see someone that looks like you there. It's definitely your business. Okay. So we did talk about like where skin cancer might present in Black people. And these are kind of two examples that I wanted to show you. This is melanoma. So the picture on the left is the spot on the sole of the foot. Okay. And the one on the right is the nail is discoloration, black discoloration on the nail bed. And you can see the discoloration is bleeding out to the skin. And that's a sign that this could be something dangerous. So this needs to be treated urgently. And if you see a spot that you're not sure about, just go get it checked. Go get it checked, right? And I also gave this talk to another group not too long ago, and someone emailed me and said, you know, she had a spot, and when she went to the doctor, they said it was nothing, but she advocated and she had it removed, and it was nothing, and she felt guilty. Like, who feels guilty for looking after themselves? Like you, no way. That it was nothing was a good result. Imagine if it was something and you ignored it. No, 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 no. We need to be advocating for ourselves, looking after ourselves, because there was no way to know that it was nothing until it was removed. And now it's removed, you're not worried about it, right? So that one. I did talk about like skin treatments, like hydroquinone, for example. I give that. But also the way skin conditions, the way skin diseases look on black skin is very different from the way it looks on Caucasian skin, on white skin. Things like peels. Like I said, some peels you cannot use on black skin. Like for example, phenol peels you cannot use on black skin. There are some lasers that should not be used on black skin. They're too harsh. They're too heavy-handed for us. Black skin needs to be treated, gently, kindly, with luxury, pampered. So when you're getting lasers, you have to know that this person knows that there are some lasers that are not good for black skin. There are some skincare products that you need to be careful about. So I want to show you an example of this common skin condition called psoriasis. So the medical textbook would describe psoriasis as the one on the right is red, raised with silvery plaques, they would say. But in the black person, it's not red, it is raised. It just looks white, it looks dry. You're tempted to want to just put some moisturizers on it and it doesn't go away, right? You put the moisturizer, it doesn't go away. But because the textbook says it looks like the one on the right, not the one on the left, but so those, and our medical textbooks are still this way. They're still this way. They're not really representative of the variety of humans that we see. So there are a couple of doctors that are working on it, and just in the past few years, there have been a few skin condition textbooks printed with Black people in mind. So slowly but surely we are getting there, but we're not there yet. So Dr. Lisa wanted me to talk about hair perming, relaxers, and yeah, I want to talk about it as well. So, and a friend of mine sent me a video a long time ago. This is almost got nothing to do with it, but it's an interesting story, so I'll tell you then. I'll link it in with this. So there's a couple on YouTube, you might know them. The man, the husband, he is a Black man, a Nigerian. His wife is a white woman, I don't know which country, but they both live in the US. And lots of people would comment on their videos about how he treats her differently. He treats his wife differently. He treats her kindly. He's very gentle with her, and that he wouldn't do that for a Black woman. And so I didn't see the previous videos, but the video where he replies to the critics, that's the one that was sent to me. And I found it really interesting because he said, no, that he would treat all women the same, all Black women, white women, he would treat them the same. This is just the way he wanted to treat his wife. And people were glitching. So my friend sent this to me, and so we then had a discussion, my friend and I, and there were a few things I told him about why that man was not being truthful, about why he was treating his wife differently, and I think that is links into this. For many of us growing up, aspirationally, beautifully, it was the white woman on our screen. The standard, the SI unit for beauty was the white woman. She might even have been blonde, but she definitely had straight long hair. She had those lashes, she had a particular shape. It's changing. The world keeps changing back and forth. It's changed a bit now. But when we were growing up, the white woman was aspirational. So for many Black men, if you saw the thing you'd placed on a pedestal from the time you were a child, I believe you would treat them differently than the thing you hadn't placed on the pedestal. That was my own theory, and I'm still sticking to it. And I think that doesn't only apply to the Black man, it also applies to the Black woman, because the thing that's beautiful, the thing that we're told is beautiful, is straight, long, luscious hair, maybe, whatever color. And that has led us to varying different things to kind of aspire to this neo-colonized look. So there are historical and cultural issues here. You're perming, you're relaxing your hair to straighten it. Isn't it interesting that the first Black female millionaire in the US was a woman who was selling stuff to straighten the hair, to straighten hair, because it's aspirational for us. It makes us look beautiful, we think. And then if you think about that, the Crown Act in the US, because bad joke, when the US sneezes, Canada catches a cold. That the Crown Act only just came into place a few years ago to protect Black women's hair. Locks, I've got locks, were not allowed. Military women were not allowed to have locks till maybe a few years ago. Many women with locks would, wrap it up, put it under a wig if they were going for interviews, because, it's just not socially, culturally, it's kind of frowned upon. So all of those things, and still till today, women, the sale of wigs is such a huge business because that's aspirational, that's beautiful to us. But there are health risks associated with chemical hair treatments, because we now know there are several studies now saying that they are hormone disruptors. They've got chemicals in them that are absorbed into the skin, because when you relax your hair, I'm sure most of us have had the perm before, it irritates the skin, it burns. It's like, oh my God, it burns. So your skin breaks, and right under there is luscious blood vessels just waiting to suck it in, all those chemicals, and they cause issues with fertility. That some studies linking it to increased risk in breast cancer, ovarian cancer, uterine cancers, and some studies linking it to infertility. I know that for me personally, in my family, my grandmother never relaxed her hair. My mom did. My mom and all her siblings. My mom has two sisters. So three of them all relaxed their hair. And the three of them had fibroids. I saw the light. I had the eureka moment maybe, I would say 10, 15 years ago. And I went natural since then. And by the 40s, by the time they hit 40, my mom, she had her fibroid surgery at age 40. So did her two sisters when they hit 40. Well, I'm beyond 40 now, and thankfully, no fibroid issues. Anecdotal evidence from my family story, but the science says that relaxer is linked. The new one that's linked now is hair extensions. So there's still studies ongoing, but the early studies are saying there are links to kind of hormone disruption issues with hair extensions, because they treat them with all kinds, and then you put them in your hair and it's tight and it's like, oh my God. And also we think that, there could be kidney problems with absorption of these things put on the skin. We think there could be lung diseases, especially for the people applying it. And some of them, they're so good, they don't use their gloves, they use their hands. So, and that constant exposure to these products. So I'll come off my high horse now. I'm all done. So we've talked about, why we might be getting late diagnosis, why we're getting late treatment. So we've talked about the systemic racism in healthcare access. We know that. How many Black dermatologists are there in Canada? There's none in Nova Scotia. I suspect, or I hope Quebec's got one, because you're kind of a more diverse community, but there's zero in Nova Scotia. And patients are worried, if I go, will they take me seriously? If they take me seriously, will they give me the right treatment? And then we don't know what to look out for anyway. If we don't know, we should be looking on the palms and the soles of the foot, and we've talked about representation and empathy. So what we need to do, we need to be training our healthcare providers. I've had conversations with my colleagues where I'm like, the last talk I gave, there were lots of doctors in there, and they were very surprised about the skin lightening, skin bleaching. They had never heard that term, which is another aspirational one, right? Light skin's better than dark skin. The lighter you are, the more attractive you are. There are banks in parts of the world that will only employ light-skinned women. And this is backed by data. There's data showing that lighter skinned women are more likely to be employed. Look at Hollywood, look at the colorism, look at some of our artists that have taken, slowly kind of lighten their skin, because that's what it is. If it affects your bottom line, if it affects your money, you will lighten your skin. I'm not saying you will, but you get what I mean. There are studies that show that the lighter skinned child in a family is less likely to be punished. So parents are loving the lighter skinned child more than the darker skinned child. So why wouldn't you lighten your skin if all your life they've told you you're the ugly one? There are skin care lightening products aimed at children. I have seen it. People send it to me all the time, lighting your child's skin. And then you wonder why there's an epidemic of kidney disease in some parts of the continent. They say 70%. There's a study that says 70% of Nigerian women bleach their skin, right? So, and immediately you lose some of the melanin that you're saying, oh, is SPF 13 protecting me? Well, you're stripping it away anyway. So now we've got nothing. We don't even have the SPF 13. We're down to 3 or 4. So all those kind of making sure the healthcare providers know, making sure our population, our community is aware, making sure that our textbooks are up to date, making sure we're using the right terminologies, instead of saying it's red, remember that in black skin, it might be darker, it might not be red, and making sure we're in research, we're kind of including all people in the research, or even research targeted at Black people, like a breast cancer research thing that we're involved in. Dr. Lisa, I think you're involved in that one as well, just kind of the experiences of Black women in breast cancer. So images and public health campaigns, like I said, policy changes. So that's where I'm putting my foot in, like, oh, you guys, come on, let's make sure we're including, Black people. We're thinking about Black people when we're making, we're doing our public health campaigns. Let's make sure sunscreen is representative. In fact, a funny one, I saw, someone told me about a sunscreen that was really good for Black skin. So I bought it and I had it, I bought it and a couple of days ago, I found it and I applied it. So I was in the living area. I found it in my bag, so I took it and I applied it, and I forgot about it. And then I went upstairs maybe at night to wash my face, and I looked in my, I'm like, oh, you're scary. Then I remembered, oh, I put this stuff on my face. So even something that was advertised as appropriate for us, it's still left like, I could see that it wasn't really 100% for us. So we need to be thinking about, are there people that want to do this research? How do we support them? How do we fund them? How do we make sure we're educating, children? I remember when my sons were little in England, and they'll say, put a sunscreen in their bag for in the summer. And all the other Black moms like, why? My Black boy, my Black daughter's okay. And just say, no, 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 no. We need to be looking after their skin now. We need to be teaching them because they'll need to look after their skin. And advocacy for yourself when you see this stuff, and for your community when you're out there, speaking to people. So I've tried not to take too much time, and I just hopefully leave some time for questions. I've got a landing page where I hope that's the dryinka.kit.com, where with time, as I write my white papers and do, kind of the conversations about Black skin. I hope to send out a newsletter. And if you need to email me, that's my email address there. And that's it. So any questions? I'll stop sharing now. Do you want me to leave this on for a bit, Dr. Lisa?
Yeah, you can unshare your screen for now, and then we'll see what happens. Yeah,
Okay.
yeah, stop sharing your screen.
Stop sharing. Okay.
Yeah, stop sharing. Yeah. So yeah, thank you very much. I love your passion, Dr. Yinka, when you speak. And thanks for the anecdotes and stories. So we do have some questions coming in here. So just give me a second. I was very happy. Thank you for talking about hair relaxers. I think that there's people just don't understand how, damaging it is, and this fight to, try to be look more white, more acceptable, right? And to really learn to embrace our beautiful curly coily hair, right? And I didn't know about extensions. This is news now. I was not expecting that. That's
This is new.
yeah,
This
that
is
is new.
new.
Yeah.
Mhm.
Yeah. Okay, so we do have some questions here. So Nono says, what is the most prevalent type of skin cancer in Black people?
Is the squamous cell, SCC. If you remember the slide I showed, so the squamous cell carcinoma is the commonest type of skin cancer. Yeah.
Okay, perfect. CCS, how do you smooth out bumpy skin on your face?
So it depends on the cause. So remember we just talked about, that it could be different, it could be psoriasis, highly unlikely. It could be acne, it could be just, a roughness in the skin. So that's one of the things you need to see someone about. I don't want you to self-treat. It could be keratosis pilaris. It could be so many different things. So it would be a good idea to see a doctor, depending on how bad it is, see a dermatologist, and then they can advise you.
Okay, perfect. That's great. When you're showing the pictures of the nail bed there, someone was asking, Cece was asking, do we need to put sunscreen on our nails too?
Very good question. So the
Yeah.
kind of cancers you get on the nail, we think it's not sun triggered. We're not sure. So this is one of the ones where we don't have the studies now because it's Black people thing. So we don't have a lot of studies. I would put some protection on my nail and I would put everywhere and
Yeah.
protect it if I can, but we don't know yet. We're not. So that there are kind of two groups of dermatologists, like 100% no, and some are like, what harm can it, cause? Just protect yourself in every way. But we don't know for sure, 100%. But
Okay.
what I would rather kind of emphasize is if you see this kind of stuff, areas on your nails or on your palm, so get it checked out early.
Okay, perfect. And what SPF do you recommend?
So there are a few brands. I know like is it CeraVe or something?
Yes.
There's a Black Girl sunscreen actually. It's
Yeah.
literally called Black Girl sunscreen. And I think there's another one. Oh, I forget the name. But so if you go into Sephora and ask them, they'll give you a few recommendations. Try them. Don't be scared. Just try different ones and see which ones you like. I usually recommend a broad spectrum. So when you go, it says broad spectrum. So broad spectrum UVA and UVB. So look for a broad spectrum. And I say SPF 30 and above.
Above, yeah.
So I use an SPF 50 broad spectrum every day of my life. I just
Okay.
make it a habit and that's it, right? It's good for anti-aging, so it reduces risk of lines and wrinkles, reduces black patches, and just protects you from sun damage. Yeah.
And are you using it only on your face or using on your whole body, under your
So
clothing? What do you recommend?
So at the moment, I'm using it on the exposed areas,
Right.
right? I'm not saying that's the ideal thing, so don't quote me. I mean,
Okay.
ideally, you should put it on all over your body,
Yeah.
but at least the exposed areas, your face down to your neck, your hands, and your legs if they're exposed.
Perfect. Nono has a question. Do UV nail gel dryers cause cancer?
Yes,
Oh, it's a great question, eh? Wow.
yes,
Wouldn't
they
have thought to
do.
ask that one.
They do. They do. So, So that is an ongoing conversation at the moment as well that they do. We think if you, because you're not in contact with them for so long, except if you're like, luxury lifestyle, glam living, you're doing it all the time. But most people I imagine are doing it like, 5, 10 minutes, once every 2 weeks, once a month. If it's me, once a year, summertime.
Yeah.
They do. And it might not be harmful to use a sunscreen on your nails before you go, or to not even do it as much as you would regularly go anyway, to cut down how often you go. They do.
So you're saying put the sunscreen on your nail bed before you go for the nail treatment?
Yes, yes. Or just
Okay. Or
before
just
they
before they apply it, I guess.
yes, put it, yes, and put, yeah, so you can get some protection.
Okay.
And yeah, mm-hmm.
I never would have thought about that. Not every woman is like, oh no, because when you go for your nails to get done, you want it to last, right? That's why you go for
Yes,
the UV nails. You don't want to pay all that money for just a nail treatment that's going to wear off in a couple days, right? So,
yes, yes.
oh no, okay. But
That's
I'm
a
thank,
great question.
yeah,
Yeah.
it is a great question. Yeah. So,
Mhm,
yeah. So, okay, that's a good tip to put the sunscreen on your nail beds just before they apply it. Okay.
mhm,
All
mhm.
right. Joanne's asking, can laser treatment for hair removal, adapted for Black people, still cause skin cancer or skin issues?
Maybe not skin cancer, but it can cause skin damage. And
Okay.
there's a videos going around where this Black woman went for hair removal on her legs, and she's ended up with these huge polka dots of where she's lost pigment. Because what's more annoying to a Black person, dark patches are annoying, but lighter patches are even more annoying. And that's what she's ended up with this. I don't know if
Okay.
it's going to heal. So with black skin, in the days when I knew about laser, I haven't updated my knowledge in a while, but I know the ND-YAG laser is good for black skin, and they have to start they have to start low and go slow. So it works out a bit more expensive, but it's safer. Then you have to ask the laser technician if they know how to work on black skin. You have to ask
Okay.
specifically, and that hopefully triggers something in them.
So what was the name? What was the kind of that laser treatment for Black
It's
skin
called,
to
it's,
go?
it's called ND-YAG. So N for November, D for Delta, YAG is YAG.
Okay. And the egg. Okay. Good to know. That's a great question. Okay. Vanessa just made a comment. The first woman to earn a personal fortune of more than $1 million, Madam C.J. Walker.
Yes.
Born Sarah Breedlove. Yeah, and I
Yeah.
saw the movie on Netflix, so it was
Mhm.
a good movie.
Yeah, it was a good movie, and it was like, and even do you know the other woman that they were kind of, what do they
Yeah,
call it? Opponent,
competing against
competitors,
it.
competitors. She
Yeah,
also became a millionaire. Did you know
right.
that?
Oh, I did
Yeah,
not know that. Okay,
all from hair straightening.
okay, yeah, okay. Vanessa's question. I already use a face lotion with SPF 15. Is it advised to still use sunblock or sunscreen lotion no matter if you're not spending a lot of time in the sun?
Yes, because the sun comes through your windows. The
Mm-hmm.
sun, so I'm here now, there's a window there, the sun comes through your windows, you're driving in your car with this big, so I would say I like the idea that you have a moisturizer that has an SPF 15. Just change it to, when this runs out, change it to a moisturizer that has an SPF 30, and then that's
Yeah.
it.
Yeah.
Mm.
Okay. Perfect. Are there any certain main ingredients that are not good for black skin in the sunscreens?
So there's a whole study, not necessary for black skin. There's a whole study about types of sunscreens. I forget the name, like oxybenzone,
Hmm.
octanoids, all those kind of big terms that might be found in the blood
Hmm.
and might be dangerous for coral reefs. So if you think about Australia, Australia has the highest incidence of skin cancer in the world, just because of, by the nature of where they are. So people use a lot of sunscreen there, and they found out that it was affecting their coral reefs. So there's been a kind of advice on which one to use. Some people did some studies and found that some sunscreen, some chemical sunscreen. You can find particles of it in the blood, but they haven't been able to show that it causes any damage. So there's been no damage from it being in the blood. It's like this worry about microplastics that we're worried about now. We know it's there, but we haven't found the damage. Will there be damage in a few years from now? We don't know. But what we know almost, so my worry is like, we know skin cancer now. We can see it now. We see it, Bob Marley's dead. But the other things, sometimes we worry about it at the detriment of what's in here now. So it's not a bad idea to kind of research the products you use. And if you find one that works for you, I'm happy with that. Find the one you like and that works for
I
you.
stick with it. Yeah, sounds good. Okay, Cece's asking, I don't know how to pronounce it. Is it vitiligo?
Yeah.
Okay, is it genetic or can you get it? And what causes it?
So vitiligo is an autoimmune condition. So autoimmune conditions are where your body attacks your body too. Does that make sense? Like your
Mhm.
blood cells attack parts of the body. So there are thyroid diseases where the antibodies attack thyroid. So vitiligo is the body's attacking the melanin making capacity and destroying it. And that's vitiligo. It can run in families because it's an autoimmune condition. So autoimmune conditions can run in families. How do you prevent it? You probably can't. It's one of
Mm.
those things that they just happen. As at the moment, we don't have, fantastic treatment for it. We have all kinds of things that we're trying, steroids and injectables and all of that. It's not yet perfected yet with vitiligo treatment. That's what Michael Jackson said he had, right?
Right. Yeah. I was wondering if you can explain the difference between UVA and UVB rays.
Oh my goodness, I should have looked that up. So
I guess the one is more deeper into the skin than the other or something, or
and one is more likely to cause skin cancer, and one is
right.
cause aging. But I can't
Okay.
remember now.
I
It's been
think
a
okay.
while.
I
Yeah.
think but UVA A for aging, maybe I think it was. And then
Yeah.
B was for the other, what was the other one?
I think it might be the other way around because I remember when I
Okay.
was looking, I was thinking, I wish UVA was for aging because that would be
Okay.
easier. But
Yeah.
there's a different. But the good thing from my thinking is now we have sunscreen that covers both
Right. Yeah.
with a broad spectrum. So
Mhm, mhm.
there's even sunscreen that protects from infrared light and all of that as well. So
And what about visible light? Is
So
that protection
visible
against
light
that?
is like the fluorescent. Yeah. So I
Yeah.
think those are like infrared
Okay.
yeah. So we've got some broad spectrum will protect because I think there was a study many years ago about you can get damage but aging. This is now a cosmetic about from fluorescent lights,
Right.
right?
Okay. Wow. Jeez. All right.
Not skin cancer, just
But
aging.
yeah, aging. Yeah. Either way, we're thankfully our skin, we age beautifully. All right. Joanne's asking, is common acne medication like minocycline, Accutane, and topical acne lotions okay for Black people?
Yes. Yes. And I encourage treatment for acne really quickly because black skin has this pesky way of scarring if you don't look after it, right? So you can get like hypertrophic scars. Those are kind of the raised scars or the dark patches that are harder to treat. So it's a good idea to treat acne early. And yes, we can have minocycline, we can have the topical treatments, we can have Accutane, and that's fine.
Perfect. Thank you. Cece's asking, what do you think of the new laser hyperpigmentation removal?
So the question, so that's a kind of laser, right?
Yeah,
So
laser hyperpigmentation. Yeah.
so it depends. So there are different kinds of laser. You remember like the Nd:YAG I told you is a kind of laser. So it depends on the kind of laser.
Okay.
So you have to check with the person, doing the procedure, what kind of laser it is, and make sure it's safe. In fact, I heard once, I don't know if it's still true, that some insurance companies will not protect providers against black skin. If you're looking after black skin, they will not provide coverage for you.
Really?
Yeah. So then that makes it like, do they want to provide care to black people? That's one. But also, if they do provide coverage, then you need to know what you're doing. It just makes you think a bit more about it. Yeah.
Yeah, yeah, okay. All right, and I think there's one last question there. Is TB related to vitiligo, and is there any research to connect tinea versicolor with anemia?
Is TV like television? Is it?
I think so. That's what Hunya put. Is TV, does
And
that
yeah,
make sense to you?
was it like television? Could you kind of explain it a bit more? Like a TV screen? If you're
Yeah, I'll let
able.
her, yeah, well, I'll let her respond. I'll go to the
Okay.
next question and then we'll see.
Okay.
Okay, no, she says no, TV being tinea versicolor.
Now, is it related to vitiligo?
Related to vitiligo, and is there any
No.
research to connect it with anemia?
So tinea versicolor, I haven't heard about any relationship. So tinea versicolor is a fungal skin infection, right?
Mhm.
And I haven't heard of any relationship with vitiligo. But then you're making me think, because trauma can start the process of vitiligo, but I don't think so. I don't think so. I
Okay,
haven't seen any studies. I haven't, and we see tinea versicolor a lot. So this is the season now. Once you get into the warmer months, like my office is going to be full of people with tinea versicolor. So, and I haven't seen any of those progressive vitiligo.
okay,
So yeah, there
okay.
might be some study somewhere, but I'm not aware.
All right, perfect. Thanks. There are two more questions that I see here. Um, what are some natural sunscreens, and is there anything we could eat to help with melanin production?
You want to get darker. Did you not hear these studies about lighter looks better? um, so sleep, slap, slop, shade. Well, so it's something like slip on a sun hat, sunglasses. The hat has to be wide brim, right? So
Right.
to cover your ears and provide that kind of full shade. So or umbrella. Clothing, they have UV protected clothing.
Clothing, yes.
So yeah, stay in the shade. Try to stay indoors or in the shade in the peak of the sun, which is usually 10 a.m. to 4 p.m. or so, depending on where you live. So kind of avoid those extremes. So those are kind of natural ways to protect yourself. And what can we eat? Nothing. Your body produces what it wants to produce. I would say more so, rather than producing more melanin, is to look after the melanin we've got. So which is kind of the whole conversation here. It will be healthy eating, eat healthy. The Mediterranean diet has got lots of evidence behind it that is good for you. Get some exercise, even if it's walking. If you can do some weights, that's also a good thing. Yeah, look after your skin, keep it clean. Moisturize it as best as you can, and protect from sun damage.
Right. Um, yeah, you mentioned the Mediterranean diet. There's also called the African Heritage Diet, which is pretty much the Mediterranean diet, but it's catered to Black people.
Mm-hmm.
All
Mm-hmm.
right. Questions keep coming in here. Are there any studies about adult acne on Black women? Any links to stress or hormones or anything else related to race?
I haven't seen that. What we know is that acne is one that respects neither gender nor race. All humans on the planet, all
Mhm.
races, all ethnicity, all social classes suffer with acne.
Okay. Okay.
It's by far the commonest skin condition.
Mhm.
So are there studies specifically in Black women? I haven't seen, but probably there would be. Could it be hormonal? Yes. So acne, there's a hormonal component, there's a bacterial component to it. There's kind of the oily skin blocking the pores aspect to it as well, and they all play into each other. Can stress trigger it? People would swear that stress triggers it, and I would believe my patients when they say that. They'll tell me, oh, every time this is happening, I'm surely going to get a breakout. Can foods trigger it? For many years, in fact, when I was in medical school, we were taught that food cannot trigger acne, but the studies have changed, and things like they've said there's some very small studies, they're not large studies, but small studies saying dairy, because many of these animals are fed hormones to fatten them up, so you're kind of getting extra shot of hormones, so that's been known to trigger it. But hormones is a funny one, right? Because you can use hormones to treat acne, and then sometimes hormones flare it up. You would see many women would say, at this point in my cycle, I would get breakouts. At other points, it would be okay. So all of
Okay.
those things can be linked.
Yeah, as you were talking about melanin earlier, I was just thinking about vitamin D. Do Black people have less vitamin D, or do we need to take more vitamin D supplements?
So the new teaching is everyone needs vitamin D,
Okay.
because there was a time I would do lots of blood work. I used to do like health screen for people coming from Africa. So they would come into the UK for health checks. And these are people that live in Africa. And I've never found one person that had normal vitamin D, not one.
Really?
Yeah, not one. Because
Okay.
you go from your house to your car, from your car to the office, you stay in the office till it's dark, then you reverse the journey. Except if we were testing maybe market women or, fishermen, people that are in the sun.
Yeah.
Most people, that's the life they live. So everyone needs
Mhm.
vitamin D
Right.
supplement.
Perfect.
Yeah.
Gotcha. Um, yeah, someone was just, Vanessa was just commenting about the Mediterranean diet and how tired she's hearing about that. It's like it doesn't really cater to Black people. So what I said, it was called the African Heritage Diet. African Heritage Diet, that's what it's called. Um, and then yes, African, yeah. So she put it in the, thanks for putting in the chat there, Anna. Um, last question. Is there anything extra or different for Black women consider when battling anxiety?
Oh, that's a whole different topic.
Yeah.
But you need to see your family physician for that. Don't leave it. Don't
hmm
don't
Well,
ignore it.
yeah, I mean, I think, just to answer that question in terms of the fact that as Black people, we deal with a lot of trauma, intergenerational trauma from our ancestors, where that cortisol is passed from generation to generation as early as 17 weeks into the pregnancy, and the ovaries are formed in the womb at early at 13 weeks. So definitely we're getting grandmas, cortisol, high cortisol levels. So that's the intergenerational trauma that's affecting us. And then the trauma of racism, is, everyday racism is traumatic, and how that affects our cortisol levels as well. And if there's any childhood traumas, childhood adverse experience, right? So all of these things cause our bodies just to be in constant fight, flight, and our bodies never learn to relax properly, and that parasympathetic, system doesn't get to do its job efficiently. So as a result, we're more prone to all of these cancers and anxieties, mental health issues. So it's really important the missing link seems to be really for us to deal with our trauma on a really concerted, take a really concerted effort to do that. All right. Um, so yes, so we have lots of thank yous. What I'm going to do is I'm just going to talk a little bit about Hawk. Thank you so much, Dr. Yinka, again for your wonderful, passionate talk about this, and we're so glad. I want to let everybody know that Dr. Yinka has volunteered her time to do this, and we're very grateful that she's been able to do that. So what I want to do is I don't know if Sharon wants to come on in a second to talk a bit about Hawk and what we're trying to do there. But I do want to share my screen here for a second.
I just want to interrupt you 1 second,
Yeah,
Dr.
sure.
Lisa. There's
Go
another
ahead.
question.
Oh, is there?
It says, what would be an ideal skincare routine look like? Example, turmeric oils, serums shared online.
Okay, let me get
So
you back on. There we go.
Okay, so a quick one. So this is from a science point of view. I'm a scientist, so I can only share what research and data and evidence-based stuff shows. So you wash your skin, you cleanse your skin, and you put a vitamin C serum. And the best vitamin C serum is one that's between a 10% to a 20% vitamin C serum. You put that on your skin first. So this is basic skincare. We're not treating any condition. We're not treating acne. We're not treating patches, just day-to-day skincare. So you put a vitamin C serum. Vitamin C serum is good for evening your skin, smoothing it out. It's also good anti-aging. And then on top of that, you can put something else depending on what you want. Maybe some niacin, but if you wanted to keep it simple, a vitamin C serum and then a sunscreen, right? Or a moisturizer with a sunscreen. That's in the morning. In the evening, you take off the grime of the day and you put on a retinol or tretinoin or retin A. They're kind of variations of the same thing. And retinol is good for treating like breakouts, acne. It's a wonderful anti-aging, and that's it. That's the basic skincare routine. There are other things you can put in there if you need it, but if your skin's healthy, you just want to keep the glow going, wash, a vitamin C serum that's between 10 and 20%, because some of them are 1%, that's useless. Some are 100%, that's useless either, as well. 10 to 20%, a sunscreen, and in the evening, you use a retinol. There are other things that can plug in, but that's basic and
Awesome.
easy to do.
Awesome. Thank you. Thank you again. Awesome information, very informative. I started wearing sunscreen a while ago. And I even find it when I put it on, it actually cools my skin the minute I put it on. So I'm like, yeah, I got to keep doing this more often. So I hope everybody just makes a decision to actually make sure to wear sunscreen all the time, because we do get skin cancer too. Okay, Sharon, I don't know if you want to come on screen, but I'm gonna share our screen here and okay, there you go.
Hi, so I just want to thank Dr. Yenka. It was very informative, really appreciated, and the questions are still coming in, so maybe we're going to have to ask her to come back for another session, maybe at the end of the summer or the beginning of the fall or something like that. I just want to just let everybody know that these are two provinces working jointly to promote health, and to this is the educational series.
Yes.
We're going to continue with the webinars and some workshops and wellness events, and we will be planning again for an event, health fair in September. So we will keep you posted. We will probably do another session in a couple of weeks. We're just waiting on confirmation, and we'll let you all know. So I thank everybody for your patience and for joining in. And also, yes, I see a question here. Will there be a copy of the recording? Yes, we will post a copy of the recording.
It'll be on the Hawk YouTube page. So it's going to be posted in a probably within by the end of the week. We'll be able to post it there once the recording saves to the computer. But yeah, and then you can tell your friends to go to the Hawk YouTube page to take a look at it. And also the one we did last time about breast wellness is there as well. With we had a technician that came and spoke. Her name was Lisa Smith. So the Health Association of African Canadians, like I mentioned, you can go to hawk.ca, get all the information you want to get about Hawk. The affiliation in Quebec is on its way. These learning series is what we started off with to kind of get the Hawk, Quebec and Nova Scotia going. So we're going to be doing more learning series with both provinces. We're going to continue that. So keep posted. You can follow our Eventbrite page, Black Lives Living Well Eventbrite page, and then you'll get notifications as to what's coming up next. We are looking for board members for the Quebec affiliation. So please, if you are like-minded people that is passionate about Black health and making sure that we get the services that we need, please do that. Hawk in Nova Scotia has been around for 25 years now, so we've got a lot of experience under our belt, and we're there to make sure that Hawk Quebec gets up on the ground as well. As well, we have the Black Lives Living Well video and booklet that's been created for Black people, and the goal is 1.5 million copies across Canada for every Black person that's in Canada. Right now, we have a NS version, and we have a national version, and it's all constantly being updated as well. So please, if you want a copy, I can send a digital copy for you. You can send an email to bllw@hawk.ca. And so basically the booklet called Know Your Numbers, it's as easy as ABC. It's your personal passport to health and wellness, basically is what it was created for. There's some information about how trauma affects our Black bodies and then some tips on how to get to help ourselves. It lists out information about A1C, which is diabetes, our adverse childhood experiences, anxiety, depression, sleep apnea, which seems to be very common in the Black community, blood pressure and cholesterol, as well as it has lots of different chronic screening, disease screening, guidelines. At the end of the day, these guidelines say to do it at a certain age, but for Black people, you can ask to have being screened earlier for a lot of them too. There's some questionnaires for mental health, just to kind of give you an idea on, if you are struggling with depression or anxiety, you may not even know it. There's some questionnaires, you can fill that out just to kind of help you know. It's not diagnostic by any means. Doesn't just because you fill it out and you get a high score does not mean you have depression or have anxiety, but it means you need to talk to somebody about it. Okay. Some information about healthy living tips. So we talked about sunscreen today. We talked about vitamin D. And then there's a great section called Doctor to Doctor. This is a section that was created where I got Black doctors to tell me, what do you want non-Black doctors to know about Black health? So for instance, recognizing that Black people, it takes a lot of effort for a Black person to show up in a doctor's office or a healthcare provider's office, all the different messages that we've been getting and distrust. And so they really need to understand where we're coming from and show that cultural competence. So there's a whole sections on what they need to know about, blood pressure, cholesterol, cancers, and that kind of thing. We have some resources, and then there's a section at the end where you can actually record your A1C levels, your blood pressure, and your cholesterol when you're at the after you've met with your healthcare provider, and keep track of that. And there's also a section for immunizations. So in the near future, we will do a presentation about the Black Lives Living Well booklet, and just to get you know a little bit more about it, we do have a video that we can show. It's a 13-minute video, and just some other Black Lives Living Well resources like the Wellness Wheel that was created just for Black people. If you have any suggestions on different topics that you want to hear about, learn about, please contact us at BLLW, that stands for Black Lives Living Well. So BLLW@hawk.ca. We'd love to hear what kind of topics you want to hear about, and we'll make sure that we find some competent people to be able to share their knowledge. So any
There's
other
some
questions?
questions in there.
I did see one last question. We have like a couple minutes left. Oh, two? Okay, well, I see. So we're gonna bring Dr. Yinka back. And I'm gonna pin you again here. Is eczema more prevalent in Black people?
I would say yes.
Yeah.
And I wonder if because Black people are more, ethnically, genetically, we originate from humid environments, and humidity is the natural moisturizer. It's just water sitting on your skin all the time. And sometimes, this dry country is not for us. We're meant to be on the beach in Jamaica sipping pina coladas, but here
Oh
we are.
yes, you're making me jealous. Oh yeah, okay.
Sometimes, yeah. That's one. Sometimes too, it's a baby care. So, there are cultural aspects. It's not in all culture, but a couple of cultures I've seen where the baby is kind of washed a lot. There's a lot of washing in trying to strip. There was a patient that told me, oh, the baby smell. If you don't wash the baby smell, the baby will have body odor. So they wash with really harsh chemicals. When you do that in a humid country, that's okay. In 2 hours, the moisture is back on. But when you do that in a dry country, that makes it even worse. So just kind of being sensitive to a baby skin and managing it with love and tenderness. But I find eczema is commoner in Black people. Yeah, we need to
Yeah, okay.
moisturize.
Perfect. Yeah,
Mhm.
okay, thanks. So just looking through the questions, yes, you can get a copy of the recording by going to the Hawk YouTube page. So we have a thank you to Sharon for bringing this to Montreal too. Just a little side note, I'm actually a Montrealer. I'm living in Nova Scotia, but I'm from Montreal too. So I'm happy to be a part of bringing it to Montreal too. But Sharon is going to be the lead person for sure. How do you get a copy of the booklet? Send an email to bllw@hawk.ca and we'll be happy to send one to you. Or I might just send a general one to everybody as well. And then could you state again where this page will be accessible again? So I guess that's probably the YouTube video you're talking about. So we have amazing thank yous and prayer hands. Like, please, thank you so much. So again, thank you. And we have clapping, I see. So thank you again, Dr. Yinka, for a wonderful presentation, this encore presentation. Your passion really shines through, and we're so happy that we have some knowledgeable Black people that can really help us with our health. So
Thank you for having me. Thank you.
yes. Okay. Awesome. So we're gonna. It's 9:19 here in Nova Scotia, 8:19 in Eastern Standard Time. So we will give you the rest of the time back. We're so grateful that you came. So please stay posted. Join the Eventbrite. Follow us on Eventbrite. Check out the Hawk website, and we'll be bringing more webinars to you at a later date. Have a great, blessed evening, everybody.
Bye.